Hello, and thank you for joining us today. I am Amber Miller, Associate State Director of Community Outreach with AARP Wisconsin. And today we will be welcoming our special guest, Dr. Ann O'Rourke, who is the Associate Professor of Surgery at UW-Madison School of Medicine and Public Health. Good morning, or good afternoon.
Good afternoon.
Thank you. And you will be focusing today on falls risk assessment, which, if you recall, September is Falls Prevention Month. So, Dr. O'Rourke, why is preventing falls of interest to a trauma surgeon?
That's a great question. I think people, when they think of trauma surgeons and they see on TV, I think they think we're mostly taking care of people who've been shot or been in car crashes. But the fact of the matter is a large proportion of the people that I take care of with severe injuries arrive at my trauma center because of a fall. And one of our main goals in trauma centers is actually to keep people from ever meeting us professionally. And so here in Wisconsin, falls are absolutely our number one cause of injury statewide, and that's certainly reflected in the patient population that I serve here in Madison. And so, of course, the best way to keep from ever having to come to a trauma center is to prevent that thing from happening in the first place. So falls are very much near and dear to my heart. If I could keep people out of my hospital, I would love it.
And if injuries from falling are so common, like you stated, is there really anything that can be done, or is it just kind of the part of aging gracefully?
Or not gracefully, as the case may be. Absolutely. Falls are not a normal part of aging. We should not accept that we're going to fall down as we age. And there are lots of things we can do to prevent falls. And some of those things that we can modify have to do with ourselves, and some of them have to do with our environment. And our primary care doctors and community resources can help in preventing falls.
And at what point should a person be concerned if, they are falling or they want to prevent from falling, and who could they talk to about this?
That's a great question. So there are a lot of programs that work with our primary care providers to help our primary care providers screen patients for falling, for risks of falls. If you've had a fall, you should absolutely bring that up to your primary care provider when you have the visit, or even make an appointment for that. The screening questions that are often asked are, have you fallen any time in the last year? Do you feel unsteady when you stand or when you walk? And do you worry about falling? And if you say yes to any of those things, your primary care doctor may go on to do some more specific physical exam and go over your medications, and possibly even recommend someone come to your home to help look for areas of your home that might be unsafe and put you at risk for falls. The screening generally starts at age 65, but that is not necessarily a hard and fast rule. And certainly if you answered yes to any of those questions that I just asked, you should talk about that with your primary care doctor.
And what is a falls risk assessment, and what does it involve?
So again, it might start with just those simple screening questions, and then we go on to check several things. And depending on maybe how you answer questions, there might be some specific physical exam things that your primary care doctor, or we might even do in the hospital. Let's say you have a fall, we are going to be doing additional assessments to keep you from falling a second time. And that might be things like checking your balance, checking your strength. There are some tests that have you from a seated position, stand up, walk a certain distance across the room, come back and sit down. That actually involves a lot of complex strength and balance to get up from a seated position, steadily walk, and then come back. It's a timed sit up and go test. There may be some tests of your blood pressure with you lying down, sitting down, and standing up. That's called an orthostatic blood pressure, because some people, because of the medications they're on or their bodies as they age, their blood pressure drops when they stand up. And if you get a little dizzy when you stand up, there's things we can do to improve that. And then if any of those things, or if you have a fall because of you tripped on a throw rug, let's say, in your house, there are ways and community resources that can come to your home and help look for things that are unsafe and help make your home environment a safer place.
And Dr. O'Rourke, I have one final question. Say somebody is watching this video and they are more of the caregiver for a family member, and maybe they're not living with their loved one, but maybe they get an inkling that there is some falling in the house. What can a caregiver do to ensure that their loved one is safe?
I think sometimes these conversations that we have with our, oftentimes our parents or our grandparents can be challenging, but I think the fear of falling is so great, and people, I think, are very much afraid of losing their independence and might not want to admit that they're having a fall. They don't want to be taken out of their home or have to change things, and absolutely no one wants that for their family member to lose their independence. And so instead, you can encourage your family member that there are so many things that we can do to help you maintain your independence, to get your strength and balance back, to make your house a safer place, to change some of the medications you're taking so you're not dizzy when you stand up. And every county in Wisconsin has a program that, if, let's say, you are a little bit unsteady on your feet, there are programs such as Stepping On, which is an exercise program that help people improve their balance and their strength so that you can maintain your independence. And so I would say, if you're a caregiver for someone, the best way you can sort of show your love and help someone maintain their independence is to encourage them to seek the help that they need, and maybe enroll in one of those programs, those falls prevention programs like Stepping On.
Absolutely. And I actually had the pleasure of shadowing a Stepping On series down here in Oak Creek, and I was just blown away at how engaging it was and how interesting it was. And I walked away learning a couple things, even getting in and out of the car. It was it was just mind blowing, and I actually think it could be good for any age.
Yeah, it's very empowering, and to admit that you've been a little bit unsteady or that you've had a fall is not going to take away your independence. In fact, there are so many ways we can help you get your strength and your balance back, that asking for help is the first step. And if it's you asking for yourself or asking for someone that you love, please look into the resources in your local community so you don't have to meet me professionally.
Absolutely. As much as we love you, we don't want to see you for that reason. And Dr. O'Rourke, do you have any final comments or any feedback or tips and tricks that you would like to share with the audience that are currently watching this video?
I mean, I just would say that take falls seriously. I think we don't often think about a fall resulting in significant injury, but of course the people that I see have significant injuries, either brain injuries, broken ribs, which can lead to pneumonia, or broken hips, which of course have big life-altering effects. And so if you have a fall and you're not hurt, that's the time to make a change in your life so that you don't have any of those terrible things happen to you. And there's plenty, again, there's just so many people here in Wisconsin that will be able to help get you the resources that you need.
Absolutely. Thank you so much, Dr. O'Rourke, for joining us today. It was really great to hear your expertise. And if you are currently watching this video, please make sure to tag your friends and family in this video, and also feel free to share this on your own social media. Especially, we're highlighting Falls Prevention Month. And thank you again, Dr. O'Rourke. We really appreciate your time.
My pleasure.
And thank you so much for joining us today. Stay safe.